Very good afternoon. Myself, Dr. Harish. I'm heading the emergency department at Aster Hospital. It's pleasure to talk about today's session. It's about cardiac arrest. So I'll keep it simple. This cardiac arrest. So what I'm going to discuss, I'm going to divide it as the first thing is how to identify cardiac arrest, and then how to seek medical help at the earliest, and how to, what you can do until the medical help arrives. So I'm going to divide this topic into three. So before going into the cardiac arrest, we need to know, we need to have some basic facts about how heart functions. Okay, so we need to have a clear idea about what is heart attack and what is cardiac arrest. Then only probably we will be able to proceed further. So heart attack, as Dr. Venkatesh sir clearly explained. So the blood vessels supplying the heart is blocked. So that is when you get the chest pain, excessive sweating, breathing difficulty, all this. So that is when you call it as the heart attack. The cardiac arrest means what happens? The heart is not functioning at all. So it is standing still. So that is when the patient develops the cardiac arrest. So before, as I informed, before proceeding into the cardiac arrest, we need to know how heart functions normally. Then we will be able to understand the cardiac arrest in a better way. So the first thing is heart. The primary function of the heart is to pump oxygenated blood to all the vital organs. The vital organs are brain, lungs, heart itself, liver, kidney. Okay, these are all vital organs, and also the limbs. So the heart pumps oxygenated blood to all these vital organs, and then heart also receives deoxygenated blood or less oxygenated blood from these vital organs back to heart, and again it pumps the blood to lungs for oxygenation. So this is the normal functioning of the heart. And when it comes to cardiac arrest, or when we consider something called basic life support, so we consider only three organs as vital organs, that is brain, lung, and heart. So in a live in an alive patient, what happens is when heart pumps blood to the brain and also to the lungs and also to the heart, so you can see, you will see him as a alive patient, alive person. So in a cardiac arrest, what happens when there is no blood supply to brain, lungs, or to the heart itself? What happens? Patient will become unresponsive, and also patient will not have breathing, and you will not be able to feel the pulse, right? So the primary function of the heart is to pump the blood, also to receive the blood. So that is why it is important that we need to know what are vital organs when it comes to cardiac arrest. So there are three vital organs, that is brain, lungs, and heart, right? So now, because I am let us consider now my brain is getting a sufficient blood supply. That's why I am conscious, I am able to speak, and my lungs are also receiving blood. That is why I am able to breathe normally, and I'm able to speak, and my heart is functioning because my heart is also receiving blood. When it is blocked, that is when you get heart attack. But when heart, because of the block, heart stops functioning completely, that is when you develop, that is when somebody develops cardiac arrest. So patient becomes unresponsive, and patient will not have breathing, and also patient will not have pulse. That is when you identify patient is having cardiac arrest. So coming to cardiac arrest proper, see this cardiac arrest can, I will demonstrate on the mannequin how to identify cardiac arrest. Before going into that, we need to know few things about cardiac arrest. See, this cardiac arrest can happen to anybody, anywhere. So it can happen when I'm traveling, or it can happen in the middle of the road, or it can happen inside a room, or it can happen anywhere. So for that matter, whenever some patient collapses or becomes unconscious in front of few people, so the first thing what you are supposed to do is you have to shift the patient to a safe area. So that is, we call it as scene safety. You have to shift the patient to a safe area, then you have to proceed your assessment. Okay, so preferably if the patient, if you are shifting the patient on a firm flat surface, probably on a floor, it would be very helpful. So if a patient develops cardiac arrest, so the first thing, how to identify cardiac arrest, I'm going to deal with it, and then how to seek medical care, and then how to start resuscitation. So for this, I'm taking help of my colleague. So Sridhar is there with me, right? I just. Camera focus ಮಾಡಿ. So we have mannequin with us now. So I'll be demonstrating how to identify cardiac arrest. So as I already theoretically explained, so the thing is, because in a normal person, heart pumping blood to brain, lungs, and heart itself, so you will have, I mean, patient will be conscious oriented and he will have a breathing. In an unconscious patient, or what happens in a cardiac arrest, heart is not pumping blood or nor receiving any blood. So that is when patient develops cardiac arrest. So the first thing how to identify cardiac arrest is by unresponsiveness. So as there is no blood supply to brain, patient becomes unresponsive. The condition unresponsive means patient even will not respond even to painful stimulus. Okay, so that is called unresponsiveness. You give maximum painful stimulus, patient will not respond anything because there is no blood supply to brain. The second thing is the patient will not have breathing, or he will have gasping. Patient will have gasping. I'll demonstrate anyway. So that's because there is no blood supply to the lungs. The third thing is there won't be, you will not be able to find out the pulse because heart is not functioning, so you will not get pulse. So how to identify cardiac arrest? The first thing is, so brother is going to demonstrate. So how to check for the unresponsiveness? To check the unresponsiveness, you have to tap vigorously over the shoulder and you have to ask the patient. So for example,
Are you okay, sir? Are you okay?
no, so at any point of time, patient will not respond to your commands. So if you are in doubt, you can always give a painful stimulus. You can give a pinch or you can give a sternal pressure over here. For that also, patient will not respond. So before doing that, as I already explained, patient should be better kept on a floor, on a flat firm surface before your assessment. So the first thing is, so the patient is not responding. I am tapping on the shoulders vigorously, but patient is not responding. So that is the first sign of cardiac arrest. So second thing is no breathing. So how to assess breathing? So what we do is we keep the hand on the patient's chest and also we look in an inclined position to look for the chest rise. Okay, so if there is a chest rise, that is an objective evidence to say that patient is breathing. So that means patient has breathing. So that is not a cardiac arrest. So whenever we keep the hand on the patient chest and there is no chest rise, then it is an objective evidence to say that there is no breathing. In some instances, you might see something called gasping or last breath. So what happens, patient will not be breathing normally. So that means to say, if I have to demonstrate, patient will have and how to identify, how to differentiate a gasping from other breathing types is, so patient will not respond to you if even though patient isn't gasping. If patient has other breathing difficulty, patient will still be responding to your commands. But in a cardiac arrest, patient will be unresponsive, then there won't be any no breathing. So that is the second thing, or patient will be in a gasping state. The third thing is we have to check for the pulse. So how to check for the pulse? Checking for the pulse is, I think, I can demonstrate, brother will demonstrate on the mannequin. So it is easy, okay, to check for the pulse. This is the midline, this is the neck, this is the midline. If I keep my hand in the midline and just roll 2-3 finger breadths to this side, then probably I'll be able to. There is a small groove over there. If you just little palpate little deep, you will be able to feel your pulse. So this is the area where we need to check for the pulse, because this is the one of the prominent blood vessels in the body. It is easy to palpate the pulse here. But if you have any issues in identifying the pulse, doesn't matter. If patient is unresponsive and have no breathing, better to start off chest compression. So by checking unresponsiveness, breathing and no pulse, combining all the three, you will come to conclusion that patient is in cardiac arrest. Just because patient is unresponsiveness, that doesn't mean to say that patient is in cardiac arrest. Or so to diagnose or to come to conclusion that patient is in cardiac arrest, you need to have three things, that is unresponsiveness, no breathing and no pulse. And then you have to call for medical help at the earliest, and then you have to start your interventions. So nowadays, as most of the people will have a smartphone access, they can just keep a mobile and they can start assessing as soon as you notice patient is unresponsive. So you can just dial the nearby medical assistance number and then you can talk to them asking for medical assistance. So they will give you based on the patient's, your assessment, they will guide you how to proceed and how to proceed with basic life support. Otherwise, it is called just compression. Okay. So how to now? So you can keep your smartphone and you can just call medical help, and they will guide you how to proceed with chest compressions. So now we have diagnosed cardiac arrest by three things. One is unresponsiveness. Second thing is no breathing. And third thing is pulse. And then we are going to call help, and then we are going to start chest compression. That my colleague is going to demonstrate now. I will be explaining it. So let's start with unresponsiveness. Then
are you okay? Are you okay? Is not responding.
He is not responding. Then check for the breathing.
Checking the breathing.
So we have to check the breathing for 10 seconds at least. So there is no breathing as such. There is no chest rise. So third thing is checking for the pulse. Again, checking for the pulse. You have to check it for at least 10 seconds. So there is no pulse. There is no breathing. Patient is unresponsiveness. So now we have come to conclusion. Patient is in cardiac arrest. So we have to start chest compression. So start chest compression. Before starting chest compression, I just want to show you how to start chest compression. And so this is the midline. Okay, this is the midline. So this is called the breastbone. Okay, the lower half of the breastbone, you are supposed to start chest compression. Okay, if I have to clearly say in terminology, these are nipples. So below this nipple in the midline, you are supposed to start on the bone. So that this is called the breastbone. You have to start on the breastbone, not on the ribs. Okay, so you have to start in the middle of the chest, that is on the lower part of the breastbone. Okay, so how to start chest compression? The first thing, so my he is keeping the whichever hand is possible. I mean, there is no restriction as such. You can start. I mean, you can use either left hand or right hand. You have to keep the heel of the hand on the middle of the chest, that is on the breastbone, lower half of the chest, and then you have to interlock like this. You have to interlock like this, and then you have to start chest compression. So
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
okay, so he will continue chest compressions like this. So the basic rules are there. When you are giving the chest compression, your hand should not bend. It should be, I mean, elbow should be locked or it should be straight. When you see, the effective chest compressions can be delivered generally on a floor. It is very difficult to deliver chest compressions on a mattress or probably on a table. So that is why we are finding little difficult. But when you keep the patient on a floor, it is easy to deliver these chest compressions. So you have to, whenever you are giving a chest compression, what you are doing is you are compressing the heart between your breastbone as well as your spine. Okay, so for that you have to, if you have to compress the heart in an effective way, you have to achieve at least 5 centimeter depth, and you have to give compressions at least 100 compressions per minute. So using these technique, if you are able to deliver chest compressions at a rate of 100 per minute, and if you are able to achieve 5 centimeters depth, okay, and also you need to allow it for relaxation, okay, chest relaxation. The reason is, when you are giving chest compression, what you are achieving is you are trying to re-establish the blood circulation to your brain, lungs, as well as your heart. When you relax, what happens? The blood will return back to heart, and again you will be able to give a compression to push the blood back to vital organs. So this principle should be there. So you have to give chest compression. Now, brother once again will demonstrate how to deliver chest compressions. So it's in the middle of the chest. I will show you once again, keeping like this. So it's here. Okay, this is nipple line. So you have to, in the just lower half of the breastbone, or we call it as sternum in medical terminology. So this is where you are supposed to give chest compression. So once again, we'll show you. You have to first keep the heel of the hand on the bone, breastbone, and interlock it, and elbow should be locked, and you have to give chest compressions, counting it 1, 2, 3, 4, 5. As you can observe, he is also counting, and he is also allowing for relaxation. He is not doing chest compression like this. So this is of no use. You have to allow it for relaxation as well. Okay, so that is most important. So you have to allow it for recoiling of the chest. Otherwise, it is called the relaxation for the effective chest compression. So now, how long you would like to continue this chest compression? So generally, this chest compression should be continued until you get the medical help, or until you get tired or fatigued. So until then, you are supposed to continue this chest compression. So the thing is, uh, identification of the cardiac arrest is most important, because if you start chest compression for, possibly for more than after 10 minutes, every so every minute delay in starting the chest compression decreases the survival rate by 10 minutes. That means to say that by the end of 10 minutes, if you have not identified cardiac arrest, if you have not started chest compression within 10 minutes of patient's cardiac arrest, the chances that patient's revival is very less likely. So that is why identification becomes most important. Then seeking medical help also at the earliest is the second priority. Third priority, to start the chest compression in a right way. Okay. So this chest compression demonstration, just looking at the demonstration, it is very difficult to learn. Probably anybody can join basic life support. It's a one-day course, and you can learn about this chest compression, how to deliver for a patient, and you can save the patient. So the most important thing is to identify and as well as call for the medical help at the earliest, or else to shift the patient to the nearest medical facility for the further resuscitation of the patient. Makes most important things in the resuscitation of this cardiac arrest. Okay, so this is about the demonstration. Now I would be happy to take few questions. One question. What is the defibrillator? Okay, defibrillator. So there is something called automated external defibrillator. It is short term. It is AED, automated external defibrillator. So generally, these defibrillators nowadays are used in most of the malls, railway stations, probably major apartments, everywhere. This is generally they are keeping nowadays. So what is the function of this automated external defibrillator? This automated external defibrillator, actually what it does is, as the name says, automated external defibrillator. It's a device which identifies abnormal heart rhythms, which is responsible for the cardiac arrest, and it will try to terminate those abnormal heart rhythms. So as I mentioned, when you seek for medical assistance, generally they come with this AED. Okay, so automated external defibrillator. So how does this defibrillator functions? So defibrillator will have two pads. Okay, so that needs to be attached one on the. So defibrillator needs to be attached here, one on the right upper chest, another one on the left lower chest. These are the two areas where you need to apply two pads. Okay, that the picture will be depicted on the pads where exactly to be applied, and what you are supposed to do is you have to switch it on the device. This device will give you voice prompts. So voice prompts. So how to proceed? So AED alone will not save the patient. You have to start the chest compression. Meanwhile, this AED device will analyze the patient's heart rhythm, okay, and it will detect if there are any abnormal heart rhythm. If there are any abnormal heart rhythm, it will give you a voice prompt to deliver a shot. So there will be a red button that will tell you to press the red button. Once you press the red button, shock will deliver and it will try to terminate that particular abnormal heart rhythm. If there is no abnormal heart rhythm, then it will tell you to continue CPR. So basically, the chest compression is the mainstay in the resuscitation or in the treatment of a cardiac arrest patient. You can register with basic life support. Most of the major health institutions are actually nowadays conducting this basic life support course. So you can take these courses in Aster CMI hospital. Sure, the contact number will be shared by our team with you. If you have any more questions, then probably I'll be able to.
Yes, doctor. Doctor, in the time of before starting the CPR,
Yes.
If we have aspirin in our pocket, can we just give him before starting CPR?
So no need. So you give aspirin in a conscious patient. Okay, he is having active chest pain. That is when you give ecosprin. If patient is already unresponsiveness, I mean in the state of unresponsive, you will not be able to give aspirin orally. Okay, patient might aspirate. So what you are supposed to do is don't delay. You identify cardiac arrest and if possible start chest compression as advised. Okay, and take the medical help at the earliest, or if possible shift the patient to the hospital where facilities are available, and en route you can continue chest compressions.
Okay, doctor, and also we have seen in some videos, for example in movies, they do the compression and they blow in the mouth. What is it, doctor? Is it a lie or is it what we have to do?
So the thing is, it's a very good question actually. So there are two types of resuscitation. Okay, one in basic life support. That is, one thing is hands only CPR. Another one is proper BLS. So hands only CPR we generally teach for layman people. For our health professionals, we generally talk about, as you mentioned. So mouth to mouth breathing, or we can give breaths. The thing is, I tell you an example. I think you will be knowing ink filler mechanism. Okay, if I just press the ink filler in the ink bottle, what happens? The ink will go out of that filler, and when I release it, what happens? Ink refill. I mean, fills back into the filler. So the same mechanism works here. When you are giving a chest compression, what happens? You are actually dragging the environment oxygen into the patient's thorax or the chest cavity. When you are releasing it, again, it goes up. So you need not to worry about giving mouth-to-mouth breathing or giving an oxygen support as such. If oxygen support is available at home, you can always put the patient on oxygen support, but if it is not available, you need not to worry. You just have to concentrate on the chest compression.
Okay. Thank you, doctor. Small request. Can you do one more session in Kannada so that I have quite a few doesn't understand English? Can put them across 20 to 30 people in this video.
Okay, fine. I'll do it. Not an issue.
Doctor, just before that, one question, Paul from Times of India. So when you did the compression, what is the frequency of the compression that we need to keep in mind? Because you said we can't keep doing it repetitively and too frequently. We need to have some sort of a gap for the air to fill in the lungs.
Madam, that's what, with every compression, you are allowing for the chest recoil to happen. So that is sufficient for what you are saying. But you have to deliver at least 100 compressions per minute. That means to say, in a second, you are supposed to do 1.5 to 2 compressions. If you have to achieve 100 compressions per minute, you are supposed to do it. That is why we count when we are delivering chest compressions. So in between what you are allowing for the chest recoiling or the relaxation, that is sufficient. You should not, okay, you have to give at least 100 compressions per minute. See, with your every compression, what is happening? you are trying to re-establish blood circulation to brain as well as to lungs and also to the heart. Okay, you can make out the red color. Okay, and that inch, the depth, what you are achieving should be at least 2 inches or the 5 centimeters. Okay, so that is when, so see, you can make out that you are allowing for the chest to recoil as well when you are giving the chest compression. So this briefs about what exactly happens during this chest compression.
Right. Okay. Thank you. Also, is any attempt to revive the patient after 10 minutes useless?
Ma'am, it is, I don't say it is useless. The thing is, yeah, our brain tolerates no blood supply for probably not more than 10 minutes. So after that, you need to know, I mean, when you revive a patient, you need to have a, I mean, good neurological prognosis. His brain should work. Okay, so that in order to do that, you have to start your resuscitation at the earliest. You have to identify that at the earliest, so that the neurological recovery is quite good. You can always start chest compression even after 10 minutes. Okay, so there is nothing like that. But I am telling you the best possible, I mean, in the sense, if you want to have a good neurological prognosis, it is better to identify at the earliest and start chest compression at the earliest.
And what is the latest that we can give a compression?
Ma'am, that is 100 compressions per minute.
No, 10 is the minimum, right? And 10 is like the best optimal time within 10 minutes. But
you have to give 100 compressions only, even after 10 minutes.
correct. No, my question is 10 is an optimal number. Within 10 minutes is a good time to save a person.
Yes,
By what time do you decide that the patient cannot be rescued?
Probably anything more than 20 minutes. More than 20 minutes. Generally, even if you try, most of the times the results will be, I mean, it is not, it won't be successful at all. You can say that you can start chest compression, but anything more than 20 minutes, the chances of revival of the patient is very, very less likely.
Thank you, doctor.
Doctor, last question. What if a patient is conscious and by the time we take him to the hospital, during that he loses the conscious? Should we try giving CPR?
So that's what, sir. If patient becomes unresponsive en route to the hospital, okay, you can always start chest compression, okay, and then you have to shift him at the earliest to the nearest hospital. Or if you are in a doubt whether patient is in a cardiac arrest, better you start off at least 5 to 10 compressions. Then if patient is conscious, generally they will respond to you. Then you can say patient is not in cardiac arrest. If patient is responding to you, definitely patient is not in cardiac arrest. If you are in doubt.
Thank you, doctor. Doctor, one quick one in Kannada, doctor, like how to do CPR.
Okay. You want to stop the show? No, stop. So ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್ ಅಥವಾ ಇದಕ್ಕೆ ಕನ್ನಡದಲ್ಲಿ ಇನ್ನೊಂದು ಏನಂತ ಹೇಳ್ಬೋದು ಅಂದ್ರೆ ಹೃದಯ ಸ್ತಂಭನ ಆಗೋದು ಅಂತ ಹೇಳೋದು. ಸೊ ಹಾಗಂದ್ರೆ ಏನಂತಂದ್ರೆ ಇವಾಗ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಅಥವಾ ಹೃದಯಾಘಾತ ಆಗೋದು ಅಂತಂದ್ರೆ ಹೃದಯದ ರಕ್ತನಾಳ ಏನಿದೆಯೋ ಆ ರಕ್ತನಾಳ ಬ್ಲಾಕ್ ಆದಾಗ ಏನಾಗುತ್ತೆ, ಅವ್ರಿಗೆ ಚೆಸ್ಟ್ ಪೇನ್ ಬರ್ಬೋದು, ಉಸಿರಾಟದ ತೊಂದರೆ ಬರ್ಬೋದು, ಅಥವಾ ಅವ್ರಿಗೆ ಹೆಚ್ಚಿಗೆ ಬೆವರೋದು, ಆಯ್ತಾ, ಮತ್ತೆ ಅವ್ರಿಗೆ ಏನು ಬೇರೆ ಏನು ಕೆಲಸ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗದಿರೋದು, ಈ ತರ ಸಿಂಪ್ಟಮ್ಸ್ ಅಥವಾ ಇದನ್ನ ಬರ್ಬೋದು. ಆದ್ರೆ ಪೇಷಂಟ್ ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್ ಆಯ್ತು ಅಂತಂದ್ರೆ, ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್ ಹೃದಯ ಸ್ತಂಭನ ಆಯ್ತು ಅಂದ್ರೆ ಹೃದಯ ಏನು ಕೆಲಸ ಮಾಡ್ತಾ ಇರಲ್ಲ, ಹೃದಯ ಪೂರ್ತಿ ಸ್ಟಾಪ್ ಆಗಿದೆ. ಆ ತರ ಇದ್ದಾಗ ಏನಾಗುತ್ತೆ ಅಂತಂದ್ರೆ ಪೇಷಂಟ್ ಪ್ರಜ್ಞೆ ಇರಲ್ಲ ಮೊದಲನೇದು. ಎರಡನೇದು ಪೇಷಂಟ್ಗೆ ಉಸಿರಾಟ ಇರಲ್ಲ. ಮೂರನೇದು ಪೇಷಂಟ್ಗೆ ಯಾವುದೇ ನಾಡಿ ಮಿಡಿತ ಅಥವಾ ಪಲ್ಸ್ ಅನ್ನುವಂಥದ್ದು ಸಿಗಲ್ಲ. ಸೊ ಅದನ್ನ ಹೇಗೆ ನಾವು ಐಡೆಂಟಿಫೈ ಮಾಡೋದು ಅಂತಂದ್ರೆ ಫಸ್ಟ್ ಪೇಷಂಟ್ ನ ಎದ್ದೇಳಿಸೋದಕ್ಕೆ ಪ್ರಯತ್ನ ಮಾಡಬೇಕು. ಸೊ ಜೋರಾಗೆ ಹೊಡೆದು ಎದ್ದೇಳಿಸೋದಕ್ಕೆ ಟ್ರೈ ಮಾಡಬೇಕು. ಪೇಷಂಟು ಈ ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್ ಅಥವಾ ಹೃದಯ ಸ್ತಂಭನ ಆಗಿದ್ರೆ ಪೇಷಂಟ್ ಯಾವುದೇ ಕಾರಣಕ್ಕೂ ನಿಮಗೆ ಯಾವುದೇ ರೀತಿಯ ರೆಸ್ಪಾನ್ಸ್ ಕೊಡಲ್ಲ, ಯಾವುದೇ ರೀತಿದು ಪ್ರತಿಕ್ರಿಯಿಸಲ್ಲ ನಿಮಗೆ. ನೀವು ಪೇಷಂಟ್ಗೆ ಯಾವುದೇ ರೀತಿ ತುಂಬಾ ನೋವೊಂದು ಪೇನ್ಫುಲ್ ಸ್ಟಿಮ್ಯುಲಸ್ ಅಂತ ಏನ್ ಕರಿತೀವೋ ಅದನ್ನ ಕೊಟ್ರು ಪೇಷಂಟ್ಗೆ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನಾನು ತುಂಬಾ ಜೋರಾಗಿ ಗಿಂಡಿದ್ರೆ ಆಗ್ಲಿ ಅಥವಾ ಜೋರಾಗಿ ಈ ಏನು ಬ್ರೆಸ್ಟ್ ಬೋನ್ ಅಂತ ಏನ್ ಕರಿತೀವೋ ನಮ್ಮ ಅದ್ರ ಮೇಲೆ ಪ್ರೆಷರ್ ಕೊಟ್ರು ಇದು ತುಂಬಾ ಪೇನ್ಫುಲ್ ಆಗಿರುತ್ತೆ. ಸೊ ಇದಕ್ಕೆ ಪ್ರೆಷರ್ ಕೊಟ್ರು ಪೇಷಂಟ್ ರೆಸ್ಪಾಂಡ್ ಮಾಡಲ್ಲ ಯಾವುದೇ ರೀತಿಲು. ಸೊ ಪೇಷಂಟ್ಗೆ ಪ್ರಜ್ಞೆ ಇಲ್ಲ ಅನ್ನೋದು ಮೊದಲನೇ ಚಿಹ್ನೆ. ಸೊ ಅದೊಂದು ಮೊದಲನೇ ಫೈಂಡಿಂಗ್. ಎರಡನೇದು ಪೇಷಂಟ್ ಉಸಿರಾಟನ ಚೆಕ್ ಮಾಡಬೇಕು. ಪೇಷಂಟ್ ಉಸಿರಾಟನ ಹೇಗೆ ಚೆಕ್ ಮಾಡ್ಬೇಕು ಅಂತಂದ್ರೆ ಪೇಷಂಟ್ ನ ಎದೆ ಭಾಗದಲ್ಲಿ ನಾವು ಈ ತರ ಕೈ ಇಟ್ಟು ಹೀಗೆ ಅಬ್ಸರ್ವ್ ಮಾಡಬೇಕು. ಒಂದು ಸೈಡ್ ಇಂದ ಈ ತರ ನಾವು ಅವ್ರನ್ನ ನೋಡಿದ್ರೆ ಪೇಷಂಟ್ ನಾರ್ಮಲ್ ಆಗಿ ಉಸಿರಾಡ್ತಾ ಇದ್ರೆ ಪೇಷಂಟ್ ನಮ್ ಕೈ ಮೇಲೆ ಕೆಳಗಡೆ ಹೋಗುತ್ತೆ. ಆದ್ರೆ ಪೇಷಂಟ್ ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್ ಅಲ್ಲಿ ಇತ್ತು ಅಂದ್ರೆ ಅವ್ರಿಗೆ ಉಸಿರಾಟ ಇರಲ್ಲ. ಸೊ ಹಾಗಾಗಿ ಪೇಷಂಟ್ಗೆ ಯಾವುದೇ ಕಾರಣಕ್ಕೂ ನೀವು ಯಾವುದೇ ಏನು ಉಸಿರಾಟ ಆಗ್ತಾ ಇರುವಂತದನ್ನ ನೀವು ಗಮನಿಸೋದಕ್ಕೆ ಆಗಲ್ಲ. ಸೊ ಅದು ಸೆಕೆಂಡ್ ಥಿಂಗ್. ಮೂರನೇದು ಹೇಗೆ ಅಂತಂದ್ರೆ ಇದು ಪಲ್ಸ್ ಚೆಕ್ ಮಾಡೋದು. ಪಲ್ಸ್ ಚೆಕ್ ಮಾಡೋದು ಅಥವಾ ನಾಡಿ ಮಿಡಿತ ಗೊತ್ತಾಗೋದು ಇದು ಸ್ವಲ್ಪ ಕಷ್ಟ ಆಗ್ಬೋದು ಎಲ್ಲರಿಗೂ. ಯಾಕಂದ್ರೆ ಕೆಲವೊಬ್ರು ಅವ್ರ ಪಲ್ಸ್ನ್ನೇ ಫೀಲ್ ಮಾಡಿ ಪಲ್ಸ್ ಇದೆ ಅಂತ ಹೇಳ್ಬೋದು, ಕೆಲವೊಬ್ರು ಅವ್ರಿಗೆ ಅದನ್ನ ಐಡೆಂಟಿಫೈ ಮಾಡದೇ ಇರ್ಬೋದು. ಸೊ ಜನರಲಿ ನಾವ್ ಏನ್ ಅಡ್ವೈಸ್ ಮಾಡ್ತೀವಿ ಅಂತಂದ್ರೆ ಪೇಷಂಟ್ ಅನ್ರೆಸ್ಪಾನ್ಸಿಬಲ್, ಪ್ರಜ್ಞೆ ಇಲ್ಲ ಮತ್ತೆ ಉಸಿರಾಟ ಇಲ್ಲ ಅಂತಂದ್ರೆ ನೀವು ಚೆಸ್ಟ್ ಕಂಪ್ರೆಷನ್ ನ ಸ್ಟಾರ್ಟ್ ಮಾಡೋದು ಬೆಟರ್. ಪೇಷಂಟ್ ಏನಾದ್ರೂ ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್ ಅಲ್ಲಿ ಇಲ್ಲ ಅಂದ್ರೆ ಅಟ್ಲೀಸ್ಟ್ ಪೇಷಂಟ್ ರೆಸ್ಪಾಂಡ್ ಮಾಡ್ತಾರೆ ನಿಮ್ಗೆ. ಇಲ್ಲ ಪೇಷಂಟ್ ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್ ಅಲ್ಲಿ ಇದ್ರೆ ಅವ್ರಿಗೆ ಅದು ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. ಸೊ ಆ ಕಾರಣಕ್ಕೆ ಹೋಗಿ ಈಗ ಪಲ್ಸ್ ಹೇಗೆ ಚೆಕ್ ಮಾಡೋದು ಅಂತ ಹೇಳ್ತೀನಿ. ಸೊ ನನ್ನ ಇದ್ರಲ್ಲಿ ಚೆಕ್ ಮಾಡೋದಾದ್ರೆ ಇದು ಕತ್ತಿನ ಮಧ್ಯಭಾಗದಲ್ಲಿ ನಾವು ಇಲ್ಲಿ ಥೈರಾಯ್ಡ್ ಗ್ಲ್ಯಾಂಡ್ ಅಥವಾ ಮಧ್ಯಭಾಗದಲ್ಲಿ ಈ ತರ ಮೂರ್ ಬೆರಳನ್ನ ಈ ತರ ಇಟ್ಟು ನಾವು ಜಸ್ಟ್ ಹೀಗೆ ಕೆಳಗಡೆ ಬಂದ್ರೆ ನಮ್ಗೆ ಇಲ್ಲಿ ಒಂದು ಹಳ್ಳದ ರೀತಿ ಸಿಗುತ್ತೆ. ಸೊ ಅಲ್ಲಿ ಸ್ವಲ್ಪ ಡೀಪ್ ಒಳಗಡೆ ಪ್ರೆಸ್ ಮಾಡಿದ್ರೆ ನಮ್ಗೆ ನಮ್ಮ ಪಲ್ಸ್ ಕ್ಲಿಯರ್ ಆಗಿ ಗೊತ್ತಾಗುತ್ತೆ. ಆಯ್ತಾ? ಸೊ ನಮ್ಮ ನಾಡಿ ಮಿಡಿತ ಆಯ್ತಾ ಅನ್ನೋದು ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ನಾಡಿ ಮಿಡಿತ ಅದನ್ನ ನಾವು ಪೇಷಂಟ್ ಅಲ್ಲಿ ಚೆಕ್ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ. ಅಟ್ ಲೀಸ್ಟ್ 10 ಸೆಕೆಂಡ್ ಉಸಿರಾಟನು 10 ಸೆಕೆಂಡ್ ಚೆಕ್ ಮಾಡ್ಬೇಕು. ಮತ್ತೆ ಈ ಹಾರ್ಟ್ ರೇಟ್ ಅಥವಾ ಪಲ್ಸ್ ಏನಿದೆಯೋ ಅದನ್ನು ಸಹ 10 ಸೆಕೆಂಡ್ ನಾವು ಚೆಕ್ ಮಾಡ್ಬೇಕು. ಆ 10 ಸೆಕೆಂಡ್ ಚೆಕ್ ಮಾಡಾದ್ಮೇಲೆ ಸೊ ಪೇಷಂಟ್ ಪ್ರಜ್ಞೆ ಇಲ್ಲ, ಉಸಿರಾಟದ ವ್ಯವಸ್ಥೆ ಉಸಿರಾಡ್ತಾ ಇಲ್ಲ ಪೇಷಂಟ್, ಮತ್ತೆ ಮೂರನೇದು ಆ ಪೇಷಂಟ್ಗೆ ಪಲ್ಸು ಇಲ್ಲ ಅಥವಾ ನಾಡಿ ಮಿಡಿತ, ಇವು ಮೂರು ಇದ್ರೆ ಮಾತ್ರ ಪೇಷಂಟ್ ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್ ಅಂತ ಹೇಳುದು. ಸೊ ಅವಾಗ ನಾವು ಚೆಸ್ಟ್ ಕಂಪ್ರೆಷನ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ. ಚೆಸ್ಟ್ ಕಂಪ್ರೆಷನ್ ಸ್ಟಾರ್ಟ್ ಮಾಡೋದು ಆಗ್ಲೇ ಹೇಳ್ದಾಗೆ ಸೊ ಇದು ಮನುಷ್ಯನ ಅವ್ರದ್ದು ಎದೆ ಭಾಗದ ಮಧ್ಯಭಾಗದಲ್ಲಿ ಆಯ್ತಾ, ಇದು ನಿಪ್ಪಲ್ಸ್ ಅಂತ ಏನ್ ಕರಿತೀವೋ ಇದ್ರ ಕೆಳಗಡೆ ಭಾಗದಲ್ಲಿ ಈ ಜಾಗದಲ್ಲಿ ನಾವು ಚೆಸ್ಟ್ ಕಂಪ್ರೆಷನ್ ನ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ. ಚೆಸ್ಟ್ ಕಂಪ್ರೆಷನ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೇಕಾದ್ರೆ ಆಗ್ಲೇ ಹೇಳ್ಕೊಟ್ಟಾಗೆ ಸೊ ಫಸ್ಟ್ ನಾವು ಈ ಕೈಯಿಂದು ಏನ್ ಹೀಲ್ ಅಂತ ಏನ್ ಕರಿತೀವೋ ಅದನ್ನ ಇಟ್ಟು ಇನ್ನೊಂದು ಕೈಯಿಂದ ಈ ತರ ನಾವು ಆ ಕೈಯನ್ನ ಇಂಟರ್ಲಾಕ್ ಮಾಡ್ಕೋಬೇಕು. ಇಂಟರ್ಲಾಕ್ ಮಾಡ್ಕೊಂಡು ಚೆಸ್ಟ್ ಕಂಪ್ರೆಷನ್ ನ ಕೌಂಟ್ ಮಾಡ್ತಾ ಅಟ್ಲೀಸ್ಟ್ 5 ಸೆಂಟಿಮೀಟರ್ ಆಳ ಒಳಗಡೆ ಡೆಪ್ತ್ ಸಿಗೋ ರೀತಿ ಪ್ರೆಸ್ ಮಾಡ್ಬೇಕು. ಮತ್ತೆ ಅಟ್ಲೀಸ್ಟ್ 100 ಕಂಪ್ರೆಷನ್ಸ್ ನ ಕೊಡ್ತಾ ಹೋಗ್ಬೇಕು. ಸೊ 100 ಕಂಪ್ರೆಷನ್ಸ್ 1 ನಿಮಿಷದಲ್ಲಿ ಕೊಟ್ರೆ ಇದು ಐಡೆಂಟಿಫೈ ಮಾಡಿ ಆದಷ್ಟು ಬೇಗ ಚೆಸ್ಟ್ ಕಂಪ್ರೆಷನ್ ನ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರೆ ಪೇಷಂಟ್ ರಿವೈವ್ ಆಗೋದು ಅಥವಾ ಪೇಷಂಟ್ ಗೆ ಮತ್ತೆ ಜೀವ ಬರೋ ಪ್ರಯತ್ನ ಆಗುತ್ತೆ. ಸೊ ಚೆಸ್ಟ್ ಕಂಪ್ರೆಷನ್ ಕೊಡ್ತಾ ಇರೋದ್ರಿಂದ ನೀವು ರಕ್ತ ಸಂಚಾರನ ಮತ್ತೆ ಎಸ್ಟಾಬ್ಲಿಷ್ ಮಾಡ್ತಾ ಇದ್ದೀರಾ, ಅಂದ್ರೆ ಬ್ರೈನ್ ಗೆ ಮತ್ತೆ ಲಂಗ್ಸ್ ಗೆ ಮತ್ತೆ ಹಾರ್ಟ್ ಗೆ ಮತ್ತೆ ರಕ್ತ ಸಂಚಾರ ಆಗೋ ರೀತಿ ನೀವು ಮಾಡ್ತಾ ಇದ್ದೀರಾ. ಹಾಗೆ ಮಾಡೋದ್ರಿಂದ ಮತ್ತೆ ಹೃದಯ ತನಗ್ತಾನೆ ಹೊಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ಅಥವಾ ಕಾಂಟ್ರಾಕ್ಟ್ ಆಗೋದಕ್ಕೆ ಶುರು ಮಾಡುತ್ತೆ. ಆವಾಗ ಪೇಷಂಟ್ಗೆ ಮತ್ತೆ ಜೀವ ಬರೋ ಸಾಧ್ಯತೆ ಇರ್ತದೆ. ಸೊ ಇದನ್ನ ಆದಷ್ಟು ಬೇಗ ಮಾಡ್ಬೇಕು. ಪ್ರತಿ ನಿಮಿಷ ನೀವು ಡಿಲೇ ಮಾಡಿದಷ್ಟು ಅಟ್ಲೀಸ್ಟ್ ಒಂದು 10% ಅಷ್ಟು ಅವ್ರು ಮತ್ತೆ ಅವ್ರ ಜೀವ ಬರೋ ಸಾಧ್ಯತೆ ಕಮ್ಮಿ ಆಗ್ತಾ ಹೋಗುತ್ತೆ. ಸೊ ನೀವು ಯಾವುದೇ ಚೆಸ್ಟ್ ಕಂಪ್ರೆಷನ್ ಅಥವಾ ಪೇಷಂಟ್ ಅರೆಸ್ಟ್ ಆದ 20 ನಿಮಿಷ ಆದ್ಮೇಲೆ ಚೆಸ್ಟ್ ಕಂಪ್ರೆಷನ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರೆ ಪೇಷಂಟ್ ಉಳಿಯೋ ಸಾಧ್ಯತೆ ತುಂಬಾ ಅಂದ್ರೆ ತುಂಬಾ ಕಮ್ಮಿ. ಸೊ ನೀವು ಆದಷ್ಟು ಬೇಗ ಏನಾದ್ರು ಪೇಷಂಟ್ ಅರೆಸ್ಟ್ ಆದ ಒಂದು 2-3 ಮಿನಿಟ್ಸ್ ಒಳಗಡೆ ಏನಾದ್ರು ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರೆ, ಇಲ್ಲ 5 ನಿಮಿಷದ ಒಳಗಡೆ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರೆ ಅವರು ರಿಕವರಿ ಆಗೋ ಸಾಧ್ಯತೆ ತುಂಬಾ ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಸೊ ಥ್ಯಾಂಕ್ ಯು.